Hi, I'm Dr. Katie Berry. I'm one of the surgeons here at Veterinary Healthcare Associates, and today we're going to talk a little bit about brachycephalic breeds. Brachycephalic breeds are what we affectionately call smush face breeds, and those are the breeds like Pugs, Frenchies, some of the Bulldogs out there that we've bred to have a shorter snout so that they have this cute snorty sound, but that can come with some complications too. When we bred these dogs, we took a normal nose dog and kind of squished everything down, but put everything that was supposed to be there in that same smaller spot. So because of that, the airway size has really decreased in size. So if you think about sucking through a straw, and I have two here, this is what a normal dog's airway might look like. This is what a brachycephalic dog's airway might look like. So all these extra tissues in the airway means that you have to create a lot more pressure to move air versus in an airway about this size. So dogs with brachycephalic airway disease, or BOAS, can have extra tissues in the back of their throat. So the soft palate that lives between the nose and the oral cavity can be extra long and sometimes thick. These dogs are also born with their nostrils much narrower than most dogs. And sometimes in the voice box, they can have extra tissue that pops out. And if you think about it, just decreases the amount of space that the air can move through, and to get all the air that they need, they have to create a lot more pressure to get that air in. That can lead to some secondary effects, such as GI signs and even signs in the urogenital system as well. And so all of that means they just have to do a lot more work to get the same amount of air that a normal nosed dog would have. So these dogs, again, are at risk of not being able to get as much oxygen. So a lot of times what you'll see is you'll hear the snorty sounds when they're breathing or when they're sleeping. Some dogs can even have sleep apnea, where they stop breathing when they're sleeping. And then a lot of times they have exercise intolerance too, where they're outside playing and they just can't play for as long as a normal dog might be able to. So there's some things that we can do to help them at home. And the big thing is keeping their weight down. So if you think about it, the more weight that's there, the more air that they have to have, and also weight in the throat or other areas can make it hard for air to pass, just like the extra tissue that we see in the airways. Also, keeping them inside during the hottest times of the day. These guys need to be in air-conditioned areas because they are at risk of overheating as well, because they're not as good at passing oxygen, which we know dogs pant to get rid of heat and things like that. So walking them during the early morning hours or the late evening hours. Don't let them outside and overexert themselves. Keep their weight down. And those are things that can help. But a lot of times these dogs do need surgical correction to make some changes into their airway to help them breathe easier. So the younger that we can get these dogs in surgically to open up their airways, the better chance that they have overall. Some of the secondary changes that can happen due to not being able to pass oxygen so well are softening of the cartilages in their voice box. And that's something that we can't reverse and that we can't treat. And so the sooner that we treat these guys surgically, the longer quality of life that they're going to have without complications. Some of the surgical options that we have out there are aimed at opening the airways. So one of the options that we have is actually opening up their nostrils, which can help move air at 4 times the rate for just a tiny little amount of change that we make. That's also one of the less risky procedures that we can perform to help them move some more air. We like doing that as young as possible, just because it can help delay some of the secondary effects that we see from them not having the bigger airways. Another thing that we have to do in a lot of these guys is shorten their soft palate. So the soft palate separates the oral cavity from the nasal cavity, and a lot of times in these dogs, that soft palate is actually going down into their windpipe, which creates a lot of turbulence and also makes it so that they can't pass as much air. So in those dogs, we go and we actually shorten the soft palate, or sometimes we'll thin it out as well. In some of our breeds, that soft palate can be very thick, which also adds to obstruction of the airway. Another thing that we can do is if there's some tissues that are prolapsed into the voice box, we can remove those too, just aimed at opening things up. One thing that we can't change is some of these dogs have a very small windpipe, and so that's one of the things that we can't change with these guys. It's important to note that we're never going to make these dogs normal. They're not going to turn into long-nosed dogs with any surgical procedure that we do. So we do still have to think about some of the things that we can do at home, like air conditioning, walking at night, and keeping them lean, even after surgical correction. So some of the symptoms that we can see, obviously most of us know if we have a brachycephalic breed, but there are some breeds that can have airway issues even if they don't look really smushed face. But snorting, snoring a lot, having really loud breathing, kind of sounding like a freight train when they're breathing, especially when they're excited. Sometimes their gums can get purple or blue, meaning they're not passing a lot of air. Some dogs will even get so severe that they collapse during exercise. Some dogs will not have a high exercise tolerance, especially ones that are severely affected with brachycephalic airway syndrome. And so those are some of the signs that we can see if we have a dog that's severely affected that probably needs surgery. So here at Veterinary Healthcare Associates, we're passionate about helping these dogs live good quality lives for as long as possible. And this is something that I'm passionate about doing and kind of the expert in doing the surgery. And so we would love to see your brachycephalic breed here. We have an all-inclusive package that is one price that includes the surgery, the hospitalization, and some other treatments that we can do to help make this experience best for your pet and get them living for healthy as long as possible. So just call into our main number and ask for a consultation for a brachycephalic, a smush breed, a BOAS surgery, whatever you say, we can get you on the schedule. And then we can have a chat about the risks and benefits for your pet and get them taken care of as soon as possible.